Good day, this is Charles Axelhesta from BSN 12H. In this video, I will be performing a return demonstration on the adult BLS, which includes the CPR and AED skills. So basic life support is an emergency management provided by the first responders, healthcare providers, and public safety personnel to people who are experiencing cardiac arrest, respiratory distress, or an obstructed airways. So first is assessment and activation. So we have here our unconscious patient, and first we have to perform the assessment and activation. So this includes shouting for help. This is to alert, call for other people's attention so that they can help in calling for medical responders. So after calling for help, we'll check for the pulse of the patient, breathing, and this allow us to know if there is an effective circulation occurring on the patient's system. And we'll also tap and call the patient to check for response. And then if there is a little no response, we'll immediately activate emergency response system or send an AED. So this includes dialing the rescue online and inform them about the situation and the patient's condition. So help, help! There is an unconscious person here. Ma'am, can you hear me? So after that is check for the pulse. And ma'am, can you hear me? So excuse me, ma'am, in the white t-shirt, please call 911. So after alerting the rescuer, we'll now do the compressions. In doing this, so we'll place our hand on the lower half of the patient's sternum, there, and then do 30 compressions in no less than 15 and no more than 18. So we have this 15 to 18 duration to allow us to check for pulse and response from the patient. So in compressing, we have to compress at least 2-inch. Remember to use the entire body weight, not just your arms, just doing when doing compression. So then we also have to remember to complete recoil. So after each compression, this is because complete chest recoil is essential because it allows the chest to fully expand, so which create negative pressure that pulls blood back into chest and cardiac tissues. So 30 compressions, then check for response. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So since the patient has no response, another set. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So in between this compression is giving of breath, or is the CPR. So we have to give 2 breaths after the 30 compressions. In giving breaths, we have to give breaths in between a span of 1 second each. Then you see that while giving breaths, there is a visible chest rise. So this means the CPR was executed. So I am going to perform the breathing. So I am going to head tilt, and then after this is we'll check for the response. Then if the patient is still unconscious, unresponsive, we have to do compressions and repeat the process again until the responders arrive. 1, 2, 3, 4, 5, 6, 7, 8, 12, 13, 14, 15, 16, 24, 2, 4, 5, 6, 7, 8, 9, 30. Then until then now for the AED skills, or automated external Defibrillator is a medical device which is used to help those experiencing sudden cardiac arrest. So this device can analyze the heart, rhythm, and if necessary, delivery and electric shock or defibrillation to help the heart reestablish and affect rhythm. So this is usually done by emergency responders. So first, we'll attach the cord to this patient, and then I am going to turn on okay. I already attached the cord, and then and also I'll do assessment or both in the patient, and then also environment to check for possible obstruction or hazard. So we have to be alert because the device will automatically analyze the patient's heart rhythm, and when it is completed, we'll have to shout or say clear. So after analyzing, we'll also have to shout clear if it is ready to shock. Clear. Okay. So after the shot is delivered, I have to switch roles. So with my co-responder for every 2 minutes. Good day, this is Resuscitation from BSN 12H. In this video, I will be performing a return demonstration on the BLS or newborn CPR. So the first thing we'll do is to determine the UpGuard score of the newborn. So this UpGuard is a quick test done at 1 minute and a 5 minute after birth. The one who meant it would tell us how well the baby tolerated the birthing process, and the uppers for 5 minutes would tell us how well the baby is doing outside the mother's womb. So first is I am going to check the documentation to know what the UpGuard score of the baby. So the baby has an UpGuard score of 3, which we know the falls within the concerning range. This means that the baby is in need for an immediate resuscitation rather. Now we'll also check for newborn's responsiveness by rubbing or tapping the back of the baby. So this rubbing this rubbing of the back will help in stimulating response from the baby. Okay, baby. And after that is, since there are no response, position the newborn on his back and call for help. So this is to activate the cold blue or doctor's quick. So I am going to press the cold blue. So the next is we'll open the airway by suctioning the mouth and nose to remove secretion, and also by doing the head tilt and chin lift to clear the baby airway. Okay, head tilt and chin, and then I am going to suck the baby, and then yeah. After that is, if there are no response, we'll use a pediatric bag valve mask or BVM for positive pressure ventilation. So attach the BVM to oxygen cylinder with 100% oxygen and cover the entire mouth and nose with BVM. Okay, I am going to attach the BVM. And then I am going to ventilate. 3 to 5. Okay. We'll also attach a monitor or pulse oximeter. So this is so that we can easily monitor the baby's pulse or heart rate. Okay, I'm going to attach. And now after checking the pulse, if the pulse is less than 60 CPM, after the ventilation, we'll now do gentle chest compression. So we'll use 2 to 3 two or three finger technique in doing the compression. So we'll place our fingers at the center of the chest like that. And after that is on below the nipple, and then press down approximately about 1.5 inches on the baby's chest. So we have to be careful not to put too much pressure, since the baby is vulnerable chest, or to avoid fractioning the baby's ribs. And then after the compression, if there is still no response, we'll ventilate again. So during the cycle of compression and ventilation, we have to observe 3:1 compression to ventilate ratio, completing the 4 cycles until we get desirable response, like if there is an elevation of baby's heart rate or pulse. Okay, I am going to perform 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Ventilate. Then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 22, 23, 24, 25, 6, 7, 8, 9, 30. Then ventilate again. Okay, so after that, we'll evaluate and check the pulse rate again, and if the rate have high rate of 100 CPM or higher, then we'll now move to the post resuscitative care. So this includes monitoring vital signs and maintaining the baby's effective airway. So I'm checking the pulse, and then after that is we'll now proceed to the documentation. So the documentation process, where it will have to input the time it started and until the time it ended, and also to the response of the baby to the procedure done. Good day, this is Charles Silhesta from BSN 12H. In this video, I will be performing a return demonstration on the BLS, or infant and child CPR. So, we have our patient here. So first thing we'll do is to open airways by doing the head tilt and chin lift, like this. Head tilt, chin lift. And then check for breathing up to 10 seconds using look, listen, and feel method. So this look, listen, and feel method will also check for breathing response of the baby. Oh wait, okay, I'm going to look and feel the breathing of the baby. And now, if there is no breathing confirmed, we'll give 2 rescue breath. This is to give breath which will stimulate response. So head tilt, chin lift. So next is we need also to check for the signs of circulation by palpating here on the carotid for infant and brachial for child. And then, if no signs of circulation, proceeds to cardiopulmonary resuscitation. So for infant CPR, infants age range about 1 month up until 12 months old. So first, we're gonna find the correct position for compression by using the 2 fingers of the lower half of the breastbone just below the nipples. And then we're gonna encircle the infant's chest with both hands and spreading fingers around the thorax. And place the both thumb together, this one, over the lower half of the sternum, like this one. And after this we'll now start compression quickly and rhythmically at the rate of at least 100 to 120 compressions per minute. So we'll be performing a total of 5 cycles here. So if each cycle will include 30 chest compressions, and then after giving 2 breaths in performing this 5 cycles, we must remember that adequate rate, adequate depth, which is 1 to 1.5 inch, and make sure that to allow chest completely recoil in between each compression. So I am going to first perform the compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. After that is for the breathing. Head tilt, chin lift. Next is the compression again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then breathing again. And then compression again. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then breathing again. Head tilt, chin lift. For the fourth, and then compression again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then breathing technique. And then for the last compression, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 7, 8, 9, 30. And then last for the breathing. Done. So now let's do a CPR for child and patient. So now let's do a CPR for a child patient. So here we have the patient here. Use our one hand in giving compressions. So like this one. And after that, same with earlier, adequate depth and rate of compression is 1 to 1.5 inches, deep at the rate of 100 compression per minute. So we'll still be giving 30 compressions in a span of approximately 8 seconds, then check for response, and then give 2 breaths. And then we'll be repeating this cycle of 30 compressions to breathing, giving for 5 times. So also, after every cycle or after 1 minute of CPR, we'll check the patients for sign of circulation by palpating the brachial pulse. So this is to check if the pulse is back to normal or stable pulse. So first one is I'm going to compression by 30 compressions. 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then check pulse. And then breathing. Then another one. Compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. After that is breathing. And then checking the pulse. Another 1, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then breathing. And after that is checking the pulse. So for the fourth one, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. After that is for the breathing. And then checking the pulse. And last, for the last compression, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Then, breathing. And then, check the pulse. Okay, and after obtaining and this desirable circulation and breathing response for the patient, we'll put the patient in recovery position. So which is putting to lay down the side way and their cheeks lying on their hand, like this one. That. And then the procedure will be documented by procedure done, including the time we started and then the time time of recovery of the patient. That's all.